McFarlane. Welcome to The Conversation with Al McFarlane. I'm glad to be here and glad to have you along as well. Today is Friday, June 2nd. We're, I think, all feeling officially into summer. Most of us, or many of us, hitting the 90-degree temperatures. And I think it's a lovely thing to have this warm heat around us. Some people don't like it, but I love it. I love it. I love it. Well, listen, I want to begin by, as I always do, inviting you to support this program. We are so happy to be able to do the program, to have the technology and to have the interest and to have the support and the ability to create a place where we can talk, where we can be together to talk about our thoughts, our feelings, our health, our well-being, our mental health, our well-being, our future. And to me, that's all the process of co-creating, of envisioning our pathway into strategies or stories or outcomes in which we are the winner. So that's where we're going always in this conversation. And Friday is always a special day. We call this the healing circle. Our focus is on healing, and our focus is on us as healers. Our focus is on you and every one of us discovering our commitment to, our capacity to, our ability to be the healer we're looking for, both for ourselves and for others as well, creating a healed, healthy community. Well, I want to start off by saying that we want to remind everybody that we're partnering with the Minnesota Department of Health to remind you in the community that the risk of COVID-19 still exists. And our message is let's continue to follow the COVID-19 protocols, wash your hands, stay aware, prioritize prevention. Together, we can create awareness, encourage testing, and help everyone stay healthy. So enjoy this show. Remember, get well, get healthy. Let's continue. Today's program is going to be great. We've got a special topic that Dr. B and Dr. Williams and I are going to engage, one that means a lot to everybody. The thought is, what's best or how do you decide whether you do a self-pay option or health insurance option to pay for your mental health therapy? What does that mean, first of all? What are the options, and where do you find your best strategy for engaging the medical services, therapy services of mental health professionals? But let me begin by inviting Dr. B and Dr. Oliver, Dr. Bravada Garrett-Akinsanya, and Dr. Oliver Williams on. And Dr. B, I wanted to, as always, invite you to initiate the protocol. And is Dr. B here? I think she's here. Yeah, there she is. Okay. How you doing, Dr. Bravada?
Morning.
Great. And let's, I'm going to turn the talking stick over to you so you can explain what we do and how we do it.
Okay, well, thank you. I'm glad to be here today. I'm really excited to just engage with community once again. We always start the ritual of using our talking stick by sitting in a circle. And although we're not in a room together right now in our spirits, we're in a virtual circle right now, even as we speak. And in that virtual circle, we have an opportunity to share who we are, where we came from. And the reason we join in circles is because when you're in a circle, there's no beginning and end, and there's no hierarchy of power. Everyone has equal access to the center, which is the space of power. So in the circle, we also honor our elders, because it's our elders whose shoulder we sit on. And because of that, we honor them. And we honor our elders because they're also closest to our ancestors. And we honor our ancestors because they're closest to the Creator. And in this sacred space, we also honor the idea of consubstantiation. That means that all living things are connected, that we as an African people exist because we are connected to a larger whole. I am because we are. And because of that experience in the circle of healing, one of the key things we always have to remember is that every body in circle matters. And for that, I am grateful. And I say ashe this afternoon. And pass the talking stick. Oh, I forgot. We use a talking stick that's virtual. And so we pass the talking stick to one another. So just letting people know, we are aware that you won't see a talking stick, but it is virtual and in our heart. So I pass the talking stick to Baba Al. Here you go, Baba.
Thank you. And I'll take that. It's I use the phrase often that you operate out of your mind's eye, and your mind's eye can see and envision and act on the virtual talking stick. So this is real, And so thanks to Yasmin, who's the producer of the program, she helps come up with ideas and questions to guide many of our programs. And she and I talked yesterday about this question of how do you pay for mental health? And we haven't had that precise discussion, though we have mentioned in the past, Dr. B, that one of the things that you do at Breakins and at the African American Child Wellness Institute is figure out a way to get the help to people whose either insurance or companies or situation won't allow them to do that. And you figure out how to make it happen. You don't turn people away. And so it's a question, how do you pay for mental health services? I can tell you, and I've said this before, I happen to be a very happy customer of yours. As a therapy customer, I have a therapist that I meet with generally every Friday, and it's a priority of my week. And for me, it's a priority and a key element of my own personal development, well-being, a place to talk, a place to raise my doubts and fears and aspirations and hopes in an arena that is not judging me or condemning me, but helping me think more clearly and helping me pass anxiety, helping me pass anger, maybe helping me pass depression. I don't think I've ever experienced depression, but I don't know. I don't feel like I have. And maybe that's a problem if I haven't, but mental health is important. And what's important to me is that I know I have good insurance that pays for it. And if I have insurance that's paying for it, especially, I need to get everything that I'm paying for out of my insurance. And I'm so happy to have found a company like Breakins that I can go to get the culturally. So I don't have to jump loops. I'm a Black man. I'm 75 years old, got a history, got a life. I'm struggling still. I still have not achieved what I want to achieve in life. And I keep raising the question to me, how do I get what I think I should be getting? Getting to do what I think I should be able to do and do better at it. And so that's what I lay on my therapist's table every week. Help me figure out what I need to do to just do a little bit better and be comfortable in myself that I'm doing what I'm supposed to be doing, that I'm not failing myself and not failing the creator. That's kind of what it's about. But I'm thankful for having the insurance. What's the point? The point is, I'm hoping that, number one, Black people in general, Black men in particular, will talk publicly and in a positive way about the value of therapy and about our need to engage mental health professionals. And I'm secondly saying that the jewel of this is that there are great people in our culture, in our community. And the beauty of that is you don't have to jump through the cultural loops. Figure out what that person, because of her or his worldview, orientation, perception of the hierarchy of humanity, you have got to figure out how they view you. When you talk to somebody that's out of your neighborhood, out of your family, you know what they know, and they know what you know as foundational, and we build from there. So I'm going on too long. But let me say this, over the course of this conversation, Dr. B and Dr. Oliver, here are some of the questions I want us to think about. You can weave it in and out whenever you want to. One is, as a mental health practitioner, what factors would you recommend that clients consider when they decide between self-pay or using health insurance for therapy. And would you explain what is self-pay and how is it different from using insurance if you have it? Second question, generally, how can clients, patients, effectively communicate their financial concerns or limitations to their therapist? Because you don't want to act like you ain't got, even if you ain't got, you want to act like, how do you maintain your sense of worth even when you need help? How do you need help, ask for help, but not feel like you are a complete abject nothing because you have to ask for help? So that's kind of the way I read that question. The third, and I'll bring some more to the table later, what advice do you give clients who are worried about the impact of using insurance on their privacy regarding this type of payment service? If they're paying for the service themselves, what records get exposed to other people? If they're going through their insurance company, what information about them that may be sensitive to them are they putting in play? So that's a lot. With that, let me pass the talking stick back to you, Dr. B, and to Dr. Oliver, and I'm gonna sit and listen, take notes. That's a lot.
Well, I'm glad to take the stick back because my mind was just flying as you were talking, my brother. And the main thing I was going to tell you is that becoming a practitioner of mental health requires the ability to talk about money. You need to be able to talk about it because that's a big deal to all of us as African Americans. In this society, we know that for every dollar a man makes, a woman makes 72 cents. We know that for every dollar a white person makes, an African American makes 62 cents. And like I said, we've got a raise. And so being able to talk about our financial status, our hopes and dreams that are around prosperity, including money, that's a core competency of a therapist. So sometimes in our trainees, we have to teach them how to talk about money. We have to teach them not to be ashamed of talking about money or not feeling like they're creating anxiety in their clients. And also when we do the first intake, we talk to clients about their insurance. We talk to them about their co-pays and their deductibles. So a copay is something you have to pay, of course. If your insurance requires you to pay $25, $30, $50 a visit, they expect you to pay that part of your bill. And we also have people who have deductibles. And when we talk about insurance and we talked about deductibles, your ability to use your insurance enough that it pays down or gives you credit for all of the bills you make towards your deductible is really an important thing for coming to be mental health. There's some people whose insurance has $7,000 deductible, $6,000 deductible. And unless you're really rich, I don't know many people who have the kind of money that they're going to pay that cash out of their pocket, write checks or use their credit card to meet a deductible that high. You could almost at least put a down payment on a good car for that much money. So I think that's one piece. But to us, it's a sacred space. So we don't want anybody coming to our office for therapy. If they can't afford it, we'll see people free. We have a grant from Department of Human Services that's allow us to meet people for free. If their insurance is inadequate, we call that underinsured, or if they have no insurance. But even before that, some people want to pay out of their pocket. So we have a sliding scale fee. So based on your family size and your income, you can see whether or not you can afford that copay. And finally, most importantly, the biggest price that people need to pay when they come to therapy is to bring their whole selves, be authentic and honest, and walk courageously to that process. Because when you're in therapy, that means you are going to bear it. It's like being butt naked emotionally. And you have to get to that place where you feel safe with your therapist so that you can reveal the good, the bad, and the ugly. And with that, I'm going to pass the talking stick to Dr. Williams. Here you go, brother.
Thank you, Bravada, Dr. B. The only other thing that I wanted to say in addition to what Dr. B mentioned was that some organizations have a sliding scale. So what they do is that they can do an assessment of what resources that you may have and then help you in the determination of what the fee is going to be. One of the things is that some practitioners really expect clients to pay for part of their therapy, and the reason is that they want to make sure that a person gets something out of it. Some people think that if you provide it only for no cost, that clients don't get anything out of it. I don't believe that. I believe that if somebody feels as though they need to come to therapy, whether it's free or whether it's a cost, they can get something out of it if they feel like they need it. But I think having conversations with the organizations is important. And another reason why I think it's important is that for people to be able to provide supports like mental health counseling, the organizations have to exist. And if you don't pay them, then they're less likely to exist. So it's important to be able to, help support them as they try to support the community. So with that, I'll pass the talking stick back to Baba Al.
Well, let me thank you. I take talking stick. Let me focus on the questions I raised at the beginning, and explain whether there are either real or imagined privacy concerns. Is it if you pay out of your own pocket? What does that mean in terms of security, privacy, your information? If you pay through your insurance company, does that mean something different? Dr. B?
You have to unmute.
Sorry about that. Yes, it does mean something very different, because when a person pays out of their pocket, that means the only person who knows that they are in therapy is the therapist and them. By law and by training, we do keep records because you need to be able to look back in your journey to see how far you've come. We need them to document that we provided the service for you, and everyone has a right to their records. Contrarily, if you go through an insurance company, there is a probability that they're going to at least know one or two things. They're going to know what you came to therapy for, because you're going to have a diagnosis. And then they're going to know that you came to therapy and that they're paying for your therapy, at least in part. Consequently, when you come to get your appointment, your first day, when you come in to do what we call the intake, you sign those insurance company paperwork, and it says that they have a right to bill for you. And they also have a right to verify that you came. So some of them want to see the case notes from when you came and what the therapist said was wrong with you. And if their treatment matches what you said was wrong, then they'll pay it. Some of them do audits, and they're hoping that the clinician did something wrong so they won't have to pay. So it's mostly around payment and keeping a record. Some professions look to see if you have a mental health record, and they make you sign a release to look into your past to see if you've had mental health. And so a lot of these things are why people are reticent or reluctant to go to therapy, because we carry that stigma that therapy means you're broken or you're weaker or you're mentally flawed. And we know as therapists that it means you're stronger than you probably know, that you're smarter than you probably know, because you're using new tools. You're coming to learn. One of my first clients said, this is like a class about me. And I said, honey, that is what it is. We're both the students, and we're on the journey to find skills that will help you be all that you can be, a better person you want to be, according to what you need. So I kind of laugh, Brother Al, when you're talking about being in therapy so you could find your better self. Yeah. I also think it takes a lot of courage. Yeah. It takes courage because it's scary up in there sometimes. So I'll pass the talking stick back to you, Brother Al.
Well, I'll start with that. I think that it's been a couple of years that I've been with my therapist, and I still think there's more for me to reveal. There's more things I want to talk about, and I think it's kind of on me to where I feel comfortable to go another level, another question, another issue. And I don't feel like the therapist is prying from me. The
Right.
therapist is available for me to listen to me as I ponder, think about, reflect, examine, review, recapitulate. And so that all is a wonderful process, but it's a process that, in a sense, allows me to set the pace of my own discovery, of my own examination, and the breadth and depth of it. And the feeling is that, uh, I gain bit by bit. I learn, little by little, as I go through this process. And and the most important thing for me again is that the resource is there, and that I was smart enough to, as you say, Dr. B, to go ask for the help, and to not even see it as help as if I need help, but help as if I have an intention of being the best me and doing the best I can. And because of that intention and desire, I'm seeking coaching,
There you go.
feedback, critique, um, uh, the ability to frame the questions that maybe I'm feeling or acting out, but haven't heard them in my mind yet. I haven't put the language around them. And so I think that's powerful. And so I do love it again. And my joy in part is the intent and desire to talk about it as publicly as I can, specifically to encourage our people, Black people, to know that we can engage this healing process on our own behalf. We can take the step. And then the question comes back to this particular conversation again. How do we do it? How do we pay for it? And how do we ensure that we prioritize? Sometimes people will say, oh, I can't afford it. I can't afford a therapist. And you've answered that question in part. But it's a good question to review again, and it's like, um, uh, you know, a broad question in that vein is, how do practitioners, what can they do to make their services more accessible and affordable, regardless of the client's financial situation or insurance coverage? You've talked about it already, Dr. B, but maybe explore that some more. And Dr. Williams, you might want to explore what that means for you in your work as well. Let me hand the talking stick to Dr. Williams first, and then back to you, Dr. B.
Well, Brother Al, one of the things that I think about is, there's some professions. I remember back in the late 70s, early 80s, and still some programs today that work around the issue of domestic violence. What they would do is that they would see men that would come in to supports, and depending on the organization, let's say that it was a individual that provided some support to provide counseling around, and they didn't charge. But again, it depends on a person's ability to survive if they without economic support. A lot of programs, as I mentioned before, have a sliding scale where they get a chance to see what they can do in terms of contributing and what the resources are for an individual seeking help. But the thing that I think is important is because you were mentioning the status of the person coming in. Are they sort of exploring a question that they want to get some insight into, versus even somebody that comes in and they are broken, Brokenness is not a bad thing
Mm.
in my sense. It's a thing where a person sort of is exploring, questions that they may have, or the fact that they may not have the support as other people have in other ways, and I think it takes strength for a person to go ask questions and to seek support from someone who's knowledgeable about what they're doing to help people investigate questions or concerns that they have. To me, that's always been strength. And sometimes people may be under the gun. And for me, what that means is that they may be in the midst of a traumatic experience. And when they're in the midst of it, that's not a place where they can put their head up so they can look around to see and to get answers to specific things if they don't get some help in terms of another listener that can help put things back to them and explore it with them and help them sort of think things through. And so I think it's important to be able to enlist someone to help support them. But again, checking with organizations to see how solvent they are in terms of being able to provide the supports, with other supports that they may have, like grants or their economic situation in terms of what they can do to facilitate the process. A lot of programs do have supports where they can provide a sliding scale, but I've seen some organizations that didn't, and I think that the heart may be willing, but sometimes people really need to have the support economically to be able to carry on. Not all places can do that, but my recommendation to people who have those have organizations is to have clients come in and ask, because there may be something they can do, as Dr. Bravada talked about, that Barkins tries to find a way to be able to be supportive. And I've seen a lot of human service organizations do that, or do it in such a way where, let's say that your insurance does it, you have a deductible perhaps, but they find another way to be able to supplement what they do. So that's, and I pass the talking stick back to Dr. B.
Thank you so much. Again, I like to emphasize a couple of things. One is that in our organization, we have two organizations. One is called Brackens. It's Bravada and Atkins, which is my last name, Brackens. And it is a private practice where many people like Brother Al come and they see licensed clinicians who are consultants to our organization. And so, of course, I don't know what he says. I don't know his business. So he gets to come in, confidentially be seen, and still help out a Black business. So I appreciate that mentioning of the hard work you do with us. And we're very honored to still have you there. We also have an organization called the African American Child Wellness Institute, ACWI for short. And ACWI focuses on children, parents, grandparents, people who are in a nurturing role in their communities, whether they're single or not, they can be served by that organization. And all of our work is mostly culturally specific. That means we specialize and prioritize in African-centered mental health, because our walk in the world cannot be the same walk, or is not the same walk, as someone who is white or are extremely wealthy. So all of these experiences that we have that make us community and collectivist in nature are things that we focus on in our work. So as we talk about integrating the cost of therapy with the cost of not doing therapy. We know that when we don't do therapy, especially with kids and even adults, when we don't do therapy, people hold that pain, they hold that hurt. And that old adage is often hurt people will hurt other people. They'll hurt you emotionally. They hurt you some other kind of way if they don't get to deal with the trauma that we carry in our minds, in our spirits, and in our bodies. So part of the role of being a courageous person stepping into that space is the reason it takes courage is because you're stepping in there and the person who's telling you not to go is often you. And the person that's telling you to go is often you. So when you get in that self-paced environment that Brother Al talked about, the therapist will work with you at whatever you bring, wherever you're at when you come in, because the goals for yourself, that's the ultimate price. So if I have somebody who doesn't have money, but they work so hard trying to heal, it's no way on earth I won't see them in that clinic. And as the clinic director, there's no way on earth any of the handpicked people I have in that clinic would not see somebody who comes to heal and seek their healing. So we see our place as a loving, healing place where anybody can go. Grandmas, great-grandmas, children, we see couples, we see premarital people, we see people who are in messed up relationships, we see parents and kids. So I want people to know that it's a safe place. And if you don't believe me, come on over there and test me and all of my staff, and you'll find out. They don't call us zip lip for nothing, because we all got bills to pay. We all need to be paid. And so we're not going to do things to jeopardize our livelihood, and We're not going to do anything to hurt you. So I'm taking that talking stick and passing it back to Baba Al.
Thank you, Dr. B. I'm Al McFarlane. This is the Conversation with Al McFarlane, our Friday session, the Healing Circle. And let me reset the conversation. It's a great conversation. And again, kudos and thanks to our producer, Yasmin Hayes, who created some language that could guide the conversation. And one of the texts she provided as background, I'm going to just read because it's well organized, and it allows us to go over the things we just went over one more time, because this is something that you can approach from this angle or that angle or this angle or that angle. And again, our topic today is self-pay versus health insurance for mental health therapy. In recent years, mental health has gained increasing attention and recognition as an essential aspect of overall well-being. And as more individuals seek therapy and counseling to address their mental health concerns, the debate between self-pay and using health insurance for these services has become a significant topic of discussion. On the one hand, self-pay for mental health therapy offers several advantages. Among them, clients who choose to pay out of pocket for therapy can maintain greater privacy, as their sessions and their diagnoses are not reported to the insurance companies or anybody else. It's between that person and that person's therapist. Additionally, self-pay allows individuals to choose their preferred therapist without being restricted by insurance network limitations. And this freedom of choice, we believe, or some would say, can lead to better therapeutic relationships and more effective treatment. On the other hand, using health insurance for mental health therapy can make these services more accessible and affordable for many individuals. Insurance coverage can significantly reduce the financial burden of therapy. It can enable more people to seek help for their mental health concerns. Moreover, insurance companies often have a list of pre-approved therapists, which can help clients find a suitable professional more quickly. However, there are also drawbacks to using health insurance for mental health therapy. That's a question being raised, actually. Insurance companies might impose limits on the number of sessions that they're going to cover. That could potentially hinder the progress of your therapy. And some therapists might not accept your insurance, and that limits the options available to people who are looking to rely on their insurance coverage. So, these are the ideas that we are discussing in this program. And for me, it's just important to have this discussion. You opened up, Dr. B, by saying that one of the tools and one of the gifts or capabilities of a therapist is to be able to talk about money, to talk about, how money plays the critical role it plays in their lives, and it's not something that you should not talk about. And having an approach or a healthy way of weighing, cost and benefit is part of this whole relationship that a person may experience in therapy. I have often, you've heard me say, because I do my therapy because of insurance, and I love it. I have good insurance, and I raise the question with every other person that I know: if you got insurance, you should go get a therapist, help you, you know. And if you're not using your insurance to get you counseling, advice, therapy that you deserve, and will benefit from, you leaving money on the table, you leaving your health on the table. And the best way to make sure you're getting what you pay for is to use every bit of what you've invested in. That's why you have the insurance. So let me stop there again. And, oh, one more thing I wanted to say. I had a great conversation. This is probably a pivot that we can get into or not get into. But yesterday I talked to an author of a book out of New York. I'm going to ask Yasmin to put his name in the chat for me, with our books editor, W.D. Foster Graham. It's our books editor. And he had invited an author out of DC who's also a journalist and also a person who has been in therapy and is a speaker about therapy. And his specialty as a journalist, Dr. Oliver, is violence between partners, partner violence. He called it
IPV. IPV.
Yeah. Intimate partner violence.
Correct.
There was an A on the end of it, something. Brother's name is Martin O. Evans. He's out of DC. Intimate partner violence and abuse.
That's right.
And it was a great conversation, a great program. And one of the things that made it great was that his book is about, he described himself, it's like in the general terms, as a gay man, but he's come to prefer language that says he's a person who loves, I can't remember the exact words. I'm going to ask Yasmin to help me with the right language. Gender loving, that's it. Okay, same gender loving person.
Mm-hmm.
So it's another way of approaching understanding without a different weight or value, loaded value the language has. But anyway, and what he talked about was the importance of therapy to him. That's where I was going with this, that it was being in therapy over a long period of time that helped him analyze his being a victim in a violent situation. And he described three kinds of violence he experienced. One was emotional, one was mental, and one was physical. And so I'm going to stop there because I've actually invited him to come back to the program. I think he'd be a great guest to have that conversation with us. But it maybe, and it triggered, the thought came to me because I think one of you said something about emotional or mental violence. So I said, oh, that's what we just talked about. So I'm throwing it out there. So I'm going to talk back to you, Dr. Oliver Williams. Put both of these topics together, the question of violence and mental health therapy. Yeah.
I think it's really important. I think it's not only important for the person that perpetrates the violence, it's also important for the person that receives the violence. And I always talk about with when people who have been the victim of abuse, that in their process of healing, well, first of all, people want to heal. They don't want to stay in the same place. And sometimes I think when they have had that traumatic experience, they fear that they're going to stay emotionally in the same place that they were after the victimization.
Mhm.
And we did a study with probably about 50 women, a qualitative study where we ended up looking at the question and asked them if they felt like there was anything that they could have done to be able to prevent it. All said no. But when and I've talked to women over the years who've been victims of abuse, and the things that they would say is that they wanted to be in a different place, but their fear was that they wouldn't be. They wouldn't move past it. They wanted to feel like they felt before the violence happened. And I talked to them about the 5 stages of change, which is what we learned from the women that we spoke to. We ended up doing a play around it. We ended up um, uh, talking about the stages where an older woman talked to a younger woman about the process of change. And when we talked to women who had been victims of abuse, they really delineated 5 different stages, where there was what happened in the first stage, which was, recognizing that they didn't deserve the violence that they experienced and it wasn't their fault. Uh, and sometimes people who do the abuse groom a person to think that they're responsible for it
Mm.
when they're not. Then the second stage is for them to find a place that's safe, uh, and in finding a place that's safe. Among the things that they talk about is, literally, I talked to one woman who had been a victim of abuse, and had moved 16 times before she felt safe. And then the third stage is questions that they may have, and questions that they have about themselves and how they found themselves in the circumstance, and and how could they expose their children to it, how they expose themselves, what is it about her or them where they felt as though a person would approach them around to be a mate or to be a partner, and then what was it about him that that the victim was attracted to that person. And then the next stage is um, kind of feeling as though they've sort of moved past that. And then the last stage is healing, but it's healing is as much for themselves, if not more, than it is for the person that did the violence. And forgiving doesn't mean forgetting. It means that you let it go and don't let this person, what they say, live in your head without paying rent.
Mm. Mm.
And so it's learning literally to let go. And there was something we were talking about a little earlier when, we were talking about people and people making choices about coming to get some help. People can discourage you from finding somebody to talk to you, and
Mhm.
discourage you from finding supports and help. But the thing that I think is important is the fact that you've got to be able to find that support and that help, despite what people say, because they may be trying to stop you for their own purposes. Because they may be afraid that the truth will get out. They may be, about what they're doing and how they're contributing to your challenges. And uh, the thing is that a person needs to go and pursue to be able to help themselves.
Mhm.
And victims oftentimes are discouraged from seeking help, or a person that does the violence and abuse really makes the effort to try to control the individual who needs the support, and to not let the secrets out or go beyond, because that means that they lose their control over that individual. And so, there are things that one needs to do who's in a place of trying to find some answers, and we can help in the support of that process. So I just want to say that, continue to seek support if you feel as though you need to get it, because that it'll only benefit you if you do. So with that,
Before
I'll
we,
it back to you, Bubba.
Yeah, I just want to do a shout out quickly to our sister, Michelle Madison, who watches the show every day. Thank you, Michelle, for being here and commenting. And thanks all to Brother Mike V. Greetings, Brother Mike V. Always glad to see you in the room as well. And to everybody else, let us know where you're watching from. And if you have the chance, let some friends of yours know. We want to grow our subscriber base to 1,000, and you can help us by becoming a subscriber. You do that by going to the YouTube Insight News channel and check and subscribe. Then you can also like and share. And what I want you to do is to get 10 of your best friends and say, let's do this together. And if 10 get 10, who get 10, who get 10, we'll be across that line real quick. So help us out by helping grow this conversation, grow this space for us to talk about the importance of our health, our wealth, and our development, our future, the future that we are the authors of, certainly the co-authors of. Well, I wanted to tie this back to the discussion question, Dr. B, if you would. I'll pass the talking to you. But the question is, given that we're talking about self-pay versus health insurance, and that self-pay does provide a level of privacy when someone is a victim of violence and also who may not be able to afford to pay out of pocket for therapy, how can a victim get the help they need while protecting their privacy? I think you've answered it already, but I think we can keep answering that because somebody might not have heard the right way the first time. I'm passing the talk stick back to you, Dr. B.
Okay, thank you. I would say there are a couple of ways people can get support. One is you could contact a couple of local agencies that do help people who are engaging in battered or intimate partner violence. And so I don't think it's always battery, which means hitting you. Somebody can abuse you by keeping your checkbook and the credit card and the car keys and separating you from your family, or taking your check and not allowing you to have money to do anything, especially get away. So all of these are forms of abuse that are violence. And I'm glad that we emphasized the three types earlier. So you could call places like, I know that we have a couple of places here in town. One is called Harriet Tubman Center, and the phone number there is 612-823-3333. Another group that does it is Phyllis Wheatley Community Center. You would call, and their number is 612-374-4342. And you can call me or Dr. Williams at African American Child Wellness Institute, our Brackens Consulting and Psychological Services. And that number is 763-522-0100. So you can just hook up in any of those places, and I can tell you, you step in the space, we'll take care of you and love you back into the work you got to do and into the health that you deserve. So I appreciate that question being out there so that we can share some resources with our viewers.
That leads me back to another concern of yours that you've articulated and you're working to bring solutions to. One of the things you do, among others, is train people. You bring our people into the profession. And I understand that probably a large percentage of the practicing professionals in therapy have come through your organization. Talk about that, and how difficult is it and how important is it to bring practitioners into the field? And what would be your vision if we had the understanding and the resources to be at an optimum level of having mental health practitioners services available to everybody in our community? what would that look like?
That's a dream and that's a vision, and it hits me very deeply because that is my life's work.
Mm-hmm.
It's that I see wellness as a right. And if suffering, if going through the pain that we've experienced as Black folks in this country and in this state and in our everyday lives, the community violence, if that's the price to pay, we have already paid it. So to me, wellness is a right, and we got to get it by any means necessary. Mental health wellness, psychological wellness, financial wellness, all of them go together in creating who we are as an individual. We are not just a mental illness. We are not just depression. We are not just anxiety. We are mothers, we are fathers, we are sisters, we're brothers, we're aunts, uncles, grandparents. We are parts of a larger group. And if one of us hurts, then it affects every single one of us. If one of us is losing and in poverty and in danger, that puts us all at risk. So I believe that when we don't let money stop us from doing the courageous work of loving ourselves and loving our community and loving our babies, if we don't let money stop us from doing that work, we will be a healthier, recovered based, power filled, awesome group. Not that we're not that already, of healed Black folks.
Well, let me push back, Dr. B, on this, and not push back, lift up more of what you said, because I hear you, and I want to bring to it what in my mind is my entrepreneurial way of looking at the situation, at the opportunity. You know, we talk about disparities all the time, and you can look at the disparities as a condition of infliction that's prevalent, and the takeaway from that description, that approach, that lens, has something to do with deficit in us. You know, and it kind of explains it away. Oh, it's just, you know, their situation, and kind of doesn't go deep. But my thing is, ought we train ourselves to look at what these things projected and presented as problems, to look at those as opportunities,
yes,
to be our best selves and to be what you just said, the healer. And it's not that we're letting money get in the way, but we're going to fix ourselves. But in the fixing, we lay claim on every asset and every resource we need to do the job. We're going to get the right tools. I don't know how to say this right, but there's something about, you might know this already, something about well, the picture in my mind is an allegory or what's the right word for a saying that says, to a certain kind of person, everything
it's like
is a hammer.
And everything looks like a nail.
Yeah, the person with the hammer, everything's like a nail. So how do we get past that and we see more broadly, more fully, and look at the challenges we have just like that? It's an opportunity, and the marching order that commissions our commitment to seeing ourselves as problem solvers, not just a problem, but our identity, our culture should be that we are a people of solutions, that we own the solution to our health. And the ownership includes the ability to command resources, time, people, programs, awareness, education to effect the solutions that we see. What do you think, Dr. B?
I think that you're right on it, and that mantra of Black Lives Matter and our own lives mattering, the belief in our, what is the word? Divine, our divine appointment on this earth, to our naturally ascribed everyday genius, created by us and with us through the author of the universe. If we realize that that power is in our spirit, we cannot fail. How do you think we stood all of that? That we're still standing, we're still growing, we're still achieving. We are designed and created to be divine, healed people on this planet. And wherever we go, things get better, not worse. We are the solution. We hold it in our spirits. And therapy helps us unlock that key to find through your own discovery how wonderful and brilliant and blessed and powerful we are. So we have that right. We have that right.
Dr. Williams, a final word from you. We've got about a minute.
Well, the thing I think about when you're thinking about that mantra, if the only tool that you have is a hammer, then everything looks like a nail. And the thing that I think about seeking support and addressing different issues is that you learn different tools to be able to respond to issues that are going on in our life. And that one is learning ways to be able to approach dealing with an issue when sometimes around disciplining children, sometimes people do it out of anger rather than out of skill. And if they go and seek support, they find different tools to be able to use to address the issue of disciplining and withdrawing privileges to be able to support, but not being overdo it. It's finding a way to be able to deal with the situation with balance. It's being, people talk about being assertive, and assertiveness is taking my needs and your needs into consideration as you dealing with a challenge. So, to me, it's skill building, and that's what we want to do as we work and seek help in dealing with mental health. So, with that, I'll turn it back to you, Bubba.
Well, listen, my dear teachers, thank you so much, as always, for the teaching that you are doing right now and the healing that you're doing right now. We thank you so much. And for those who are listening, watching, sharing, let folks know that we do this every Friday, and we want you to be part of it as well. Let me close by thanking again our partners at the Minnesota Department of Health, who want you to know that COVID-19 vaccines are free because we want you to stay safe. I'm Al McFarlane. This is The Conversation with Al McFarlane, the Healing Circle. We'll see you next week.